We are talking about all this, just 5 minutes. And because this was a sort of a concluding event of the whole project, and we expect some new project, Rifat, we are getting some more money. And you were the one, since initial stages, that you are involved in it. And we were trying to get that academy also benefit and the youth benefit. So we get some more project, and you will be more actively involved, all of you, somehow. We will be having the list of yours and this. So when we talk about, emerging pathogens, क्या opportunities हैं और क्या challenges हैं आगे के लिए? What the world would be 20 years down the road? And this is just last week I was in Geneva, bioweapon convention, every 5 years we discuss what's happening. तो अब की जो बात है कि you can get something terrible without deploying a weapon. How? कि जी आप weapon मत फेंको, लेकिन आप वो you can get the results of, terrorizing the community. कैसे? Through this mobile. Misinformation, disinformation. You spread a news that vaccine is very dangerous for you. You spread a news that, oh, come on, this was happening every 100 years, कि जब TV के signal आए तो ये बीमारी आई, and when this came to that happened, अब G4, G5 आया तो this is happening and that is happening. So please don't vaccinate yourself like this. If you don't vaccinate, the disease will spread. And you don't need a weapon to throw there. Just do that. Like in polio, now it's happening. Pakistan is probably among the only 2-3 countries that are suffering. We got now more than 50 patients. Why? Because we are killing people who goes and have drops for your children. आपने इतना वो फैला दिया कि जी इसमें जो है ना, you will not have children in the future. अल्हम्दुलिल्लाह हमारी तो ऐसी आबादी बढ़ रही है कि जैसे क्या कहूँ, I don't want to say anything. तो इसके बावजूद के पोलियो में फैला रहे हैं, तो फिर और क्या करें? So that's what's happening, and that's what you think about it. Now, when ये कुछ उन बच्चों के लिए, those who are BS students and new to this discipline, कि what is this emerging pathogen? Just 1 or 2 lines. कि जी microorganisms जो हैं, viruses, bacteria, fungi, etc., that pose new or increasing threat to public health. And this can be newly identified, कि जो अभी तक नहीं हुए, or re-emerging pathogen, जो once we had removed it from the world and now it's coming. For example, there was a pathogen that killed millions of people. US saved it somewhere, Russia saved it somewhere, it was wiped out from the world. Now they're trying to recreate it in the lab to see कि अब क्या हो रहा है. So some kind of crazy labs also that we talk on that. So that is, some are coming up. For example, there are strains for SARS, जो COVID-19 है. There are different theories, but the famous one is that it evolved. It came from animal to human. And where it came, how it came, because there was an eating habit in China, for example, blah, blah, blah. So that's what. And the other one is re-emerging, that was once controlled or less prominent, but is coming up again. And the examples are some drug-resistant tuberculosis, for example, malaria, for example. They evolved them. They are living organisms. They also evolve themselves when you work. Oh, आप करोगे या मैं करूँगा? Not happening. Go ahead. अब ये emergence के लिए some factors, environmental changes, climate change, everybody knows it, because the living organism, they adapt themselves, they evolve themselves, they work on it parallel to whatever is happening because of your activity as because of nature activity, what you call it, environmental changes or climate change. And that is because the human influence in biodiversity loss, cutting forest, then the animal find themselves somewhere else. They either go up or down, and along with them, they carry pathogen, and the pathogen too, they evolve themselves. And then social factors, for example, urbanization. You look at Islamabad, those of my age can understand what was Islamabad 20, 30 years back and today. Same is true, all of you, those who are coming from your, villages. Look at your village, how it was when you were born initially in your childhood, and how is it today? So that's urbanization, population density, global travel and trade. Now you can travel 24 hours, you can go from one part of the world to the other part of the world. So you carry along with you your luggage, different kind of things that are adapt themselves there, or this is how you spread it. Genetic factors, of course, evolution, mutation, etc., etc. आगे जाओ भाई. Now, global concern क्यों है अब इस पे? जाहिर है जब whatever I said, one, threat to public health, of course, because more morbidity and more mortality, people die because of all these new, and you have watched, almost every family has a member died in COVID. My family had two. So young people. So that happens. In Africa, you are still a bit more lucky as compared to some other least developed country in Africa, that they have many other diseases that are going on, Ebola, etc. Or overburdened healthcare system when you are a poor country. Same is true for Pakistan. Pressure आता है on the hospitals and the labs and diagnosis, etc., etc. And then things are again worsening. Hospitals have less resources. Believe me, I was Chancellor 20 years back in one district, and I established 2 medical colleges there. And at this time, I had a young brother. When I went to the hospital, apne toba kiya. He died the same time because there was no ICU, nothing, no facilities available. And people told me, even in Karachi, if you don't have money, even in Islamabad, you will be really suffering, because the facilities for the public are of not that standard that could keep you alive for some time, or somehow they could help you to survive that strain that you are carrying along with you. Antimicrobial resistance, a lot of, use antibiotics since your childhood. The child born that starts, injecting antibiotics. And that's another story. Somebody will be talking in the details. Economic disruptions, global trade, commerce, when there is, like in COVID, we suffered. Lockdowns, no movement, etc., etc. Cost of containment, billions of dollars are needed when you try to contain. And social disruption, education, work, laboratories, students, online cheating, kya you can do, sitting there, and you have also evolved yourself for that. Kaise karna hai, enjoy. I had experience last 3 years then when we were there. And of course, mental health challenges, when you don't have a lack of resources, your family doesn't have enough resources. So in Pakistan too, specifically, I tell my teacher, this youth is under pressure. Please help them out. इनको आप बियर करो, जब ये थोड़ी सी इधर उधर कर ले, खैर है, कोई बात नहीं. बच्चों को you have, because the pressure that they are under in their resources, their family, their background. So that's how inequality and access issues. कोई बहुत ज्यादा मालदार है तो कोई बहुत ज्यादा गरीब है. Not only in one country, but globally. कोई तो पैसे पे पैसे कमा रहे हैं और उसके लिए millions of people are being killed just for a small piece of land. So this is what is happening globally too. So that these are the issues that we need to really This is the objectives of this last one. This is what we understand the emerging pathogens. I hope when you finish these 2 days, you understand the whole concept of emerging and re-emerging pathogen. You have more collaboration, mashallah, students, interdisciplinary. People from Sawat, people from Mardan, people from international, global will be talking to you. We have invited people from USA, from Germany, we have friends here, from China, from many countries. Central Asia, 3-4 speakers from Central Asia. So we, because of the personal links that we have, they will all be talking to you, and they are open for you to come over. आपके माशाल्लाह यहाँ बच्चे बहुत हैं और उनके लिए फैसिलिटी बहुत है. वो बच्चों के लिए तरस रहे हैं. So they need young people like you. So that will be an opportunity for you. And then we will we will be discussing global challenges and how can we have multidisciplinary approaches. Kuch examples, COVID-19 you had already had, Zika, Nipah, Shahid Beg may be talking about more. He is a key person for this. And then the drivers of emergence. As I say, I'm now concluding. One, globalization, increased travel, climate change, deforestation, and urbanization. Poor health infrastructure and solutions kya hai? The solutions are strengthening surveillance system globally, क्योंकि nobody is safe unless everybody is safe. तो अमीर मुल्कों को पैसा डालना होगा गरीब मुल्कों में, क्योंकि if we are having something, we will be giving them a gift when we travel there. So they have to put resources in the poor countries to save themselves, not only us. So that's another, promoting interdisciplinary research, public-private partnership, enhancing local capacity, diagnostic, therapeutics, etc., and one health approach. I think somebody will talk about this too, because diseases from you goes to your domestic and other animals and vice versa. So this is what we call three components of one health: you, animals, you call it biodiversity, and the environment. This all together, you have to look for everything, not only the humans. Otherwise, you will never be safe. Next, please. Now, the opportunities, because of all this, there's scientific advancement now, genomics, AI. We were talking in Malaysia, I was there for, vaccine and your genomics. कि जी अब personalized medicine है तो personalized vaccine होगा कि किसको कौन सा vaccine लगना है या नहीं लगना है. In next 5 years, you will understand because of all your data. Maybe something is good for you, but not for me. The dose may be different. So there are several things that we are lucky we are living in this era if we really try to learn all this. And my university, new university, now my genomics and AI people work together. Now we are having microbiology, biotechnology, AI, computer sciences. They have a group and they work together. So now this world, even the social scientists. And then global collaboration, as I said, ये हमारे लिए नहीं करेंगे, हम पे पैसे इसलिए नहीं निछावर करेंगे कि because हम बड़े खूबसूरत हैं. Because if we are safe, they are safe. उनको चाहिए बंदे और बंदे will travel. So this is will strengthen more public awareness, policy making. Challenges are limited resources because they will prioritize. कि जी कौन से, अच्छा, when we talk about diseases, poor man disease and rich man disease, पता नहीं आप लोगों ने कितना सुना होगा कि पहले तो ये concept बड़ा था कि जी rich man की जो disease है, कैंसर है, हार्ट है, फलाना फलाना, they invest on that, और जो आपके मस्कीटो मच्छर जो आपके हैं तो आपको मुबारक. So these are the things that you again work on it. Inequitable access, rapid mutation, evolution, and policy and governance. आपके मुल्कों की priorities क्या हैं? कि उनकी प्रायोरिटी ये है या उनकी प्रायोरिटी वो है कि जी बंदे खरीद के अमेंडमेंट करें. तो डिपेंड्स ऑन द प्रायोरिटीज ऑफ द गवर्नमेंट टू डिफरेंट गवर्नमेंट. बट हैविंग सेड दैट, pessimistic, we should not be pessimistic, optimistic. We have science has done wonders in the world, and that is look at smallpox. As I said, this was eradicated long ago. Yeah, it will be our fault if we try to recreate it again by the developer, what they are trying to do it. We are discussing this at the UN level. COVID-19 को देखें, vaccine 10 साल लेता था. Now you can get it in months virtually. थोड़ी सी sacrifice करनी होती है. So this is what the development is. Now you have messenger RNA technology, for example. And then global surveillance networks. WHO ने बड़ा काम किया. बड़ा exchange of knowledge, information, everything was available on your tips. कितने बंदे गए, कितने बंदे हुए. May not be perfect, but you still can have things available for you. पाकिस्तान का आप थोड़ा सा अपने पे आते हैं. What we can do in combating pathogen. हमने बायोसेफ्टी बायोसिक्योरिटी मैयर थोड़े से अपने लैब्स को ठीक करना है. बच्चों को ये जो आज की एफर्ट है, इसी का एक पर्पज है कि हम आपको समझाने की कोशिश, एक नाकाम कोशिश कर रहे हैं कि हाउ कैन यू बिहेव इन योर लैब्स. बहुत सारे डेवलपमेंट में चाइना में हुआ इन द लैब्स कि वो थिंग्स वर गेटिंग आउट ऑफ देयर. इवन इन यूएसए, इन द सम कंट्री साइड, not deliberately, mistakenly, diseases went through the bodies to the villages, and then they were having troubles with that. So that is that we have to understand biosafety, biosecurity, active participation in health initiatives, contribution to research, vaccine development, partnership with international organization. No country, no individual, no continent in the world alone can save themselves. So we all have to work together. So actions, जो यहाँ से हम recommendation Dr. Ali भेजेंगे, that will be कि ये prioritizing fund for health and research. हम अपने government को भी advise करेंगे as an academy, and we will be sending this to China and other organizations that we are working with. And foster innovation capacity building. हमारे youth को modern technology, modern labs, this should be available for, complete degree or visits, 3 months, 6 months, 1 year. We are discussing, we are negotiating, we'll be sending you out. And we had already sent once a team from Khyber to Karachi. We selected youth like you and sent them to Belarus when I was Secretary General here. So we sent a team, selected people, and they went and they spent a few days there to understand the labs and mechanisms. So this is what we can do it again with China and other friends, and then strengthen public health policies and build resilience in health system. This is the most important that we need to work on. So funding के लिए allocate fund कैसे करें? Now the details, little bit of it, I'm just going through, passing it out about infectious disease. We put resources. Pura Africa continent did not produce a single dose of vaccine for their population. Development का ये हालत. So now this is time, or wo IPR issues, this issues and that issues. So we have to focus the poor countries too about, vaccines and others to work on. And of course, capacity building of our youth. We have brilliant mind, believe me. You are much more better because you are living in an era that all your knowledge is in your hands. Libraries को जाने की जरूरत नहीं है. मेरे क्लास में कुछ ऑफ मेरे स्टूडेंट सीनियर बैठे हुए तो बूढ़े हो गए, तो अब मैं उन्हें कहता हूँ मोबाइल ऑन रखो. Evening we say them a topic, let's say we talk about One Health. Tomorrow I don't talk, I just facilitate. And they talk. And you don't need even to go to library, etc. And you have the most modern knowledge in your hands. So that's how you work. आगे जाओ भाई. So together we can make a difference. We all have to work together, irrespective of our discipline, specializations and countries and caste and color and gender. हमने सब ने मिलके काम करना है और पब्लिक हेल्थ पे काम करें, हेल्थ पॉलिसीज पे, resilient in health systems. Last slide, I think I'm thanking everybody. If you have my last slide, especially Dr. Ali and his team, and this young girl and my academy staff and everybody. ये project आपने बड़े अच्छे तरीके से handle किया. I was in ANSO meeting and they were appreciating this. One of the success stories of our ANSO project. We have many projects in many countries because I'm working for the whole world. So, but this was declared as one of the best initiatives. And thanks Ali for doing all that and all other people. Thank you very much.